Are you at risk? This might be a question you've asked yourself before, but today we're specifically talking about the risk of colon cancer. Colon cancer, also known as colorectal cancer, is a type of cancer that starts in the colon or rectum. It's a global health concern, ranking as the third most common type of cancer in men and the second in women worldwide. Every year, nearly 2 million new cases are diagnosed, making it a silent yet prominent threat to our health. While these figures can be alarming, the good news is that colon cancer is preventable and highly treatable if detected early. Early detection is key, and that's where understanding the warning signs comes in. You see, colon cancer often starts with small, non-cancerous clumps of cells known as polyps. Over time, these polyps can become colon cancers. But here's the thing. Many people with colon cancer experience no symptoms in the early stages of the disease. When symptoms appear, they'll likely vary, depending on the cancer's size and location in your large intestine. That's why it's essential to be proactive and educate ourselves about the potential warning signs. Knowledge is power, and in this case, it could very well be a lifesaver. Our purpose today is to shed light on this critical health issue, to bring it into your consciousness, and to arm you with the information necessary to identify potential warning signs. Remember, the sooner colon cancer is found, the better the chances are for recovery. It's not about creating fear. It's about promoting awareness and early detection. It's about taking control of your health and making informed decisions. Now let's dive into the warning signs of colon cancer that you should be aware of. We'll be discussing 6 key signs that could indicate a potential problem. Each sign will be explained in detail to give you a comprehensive understanding that could help you, or someone you care about, identify this disease in its early stages. Knowledge is power, and today, we're empowering you with the information you need. So, let's get started. The first warning sign we're going to discuss is changes in your bowel habits. Now, what do we mean by changes in bowel habits? Well, it could be anything from constipation, diarrhea, narrow stools, or a feeling that your bowel doesn't empty completely. It could also be a change in the frequency of your bowel movements. You might find yourself going more or less often than usual. What's important to remember here is that everyone's bowel habits are different. Some people may go 3 times a day, while others may go 3 times a week. What's normal for you might not be normal for someone else, and that's okay. It's when you notice a sudden change, a departure from your normal. That's when you should start paying attention. So why could this be a warning sign of colon cancer? Well, tumors in the colon can obstruct the passage of waste, altering how and when you go. This is why a sudden and persistent change in your bowel habits could indicate something's not right. Now, it's important to note that changes in bowel habits are common and often due to less serious causes like changes in diet, stress, or a stomach bug. So don't panic if you notice a change, but if this change persists for several weeks or is accompanied by other symptoms such as rectal bleeding or abdominal discomfort, it's definitely time to consult your healthcare provider. Paying attention to these changes is crucial. Early detection of colon cancer can significantly increase the chances of successful treatment. And that starts with you being aware and attentive to what's normal for your body and what's not. So to put it simply, listen to your body. It's often the first to know when something's off. And while changes in bowel habits might seem like a topic we'd rather avoid, it's a conversation that could potentially save your life. Remember, sudden and persistent changes in your bowel habits could be a sign that something's not right. Our second warning sign is rectal bleeding or blood in your stool. Now, this is a warning sign that should never be dismissed. Rectal bleeding or blood in the stool may present itself in several ways. You might notice a bright red color on your toilet tissue or in the toilet bowl. Sometimes it might not be as obvious. Your stool may appear dark, almost black, indicating that blood has been digested before being passed out. Why is this a potential sign of colon cancer, you ask? Well, colon cancer can cause polyps or small clumps of cells to form on the inner lining of the large intestine. Some polyps can become cancerous over time. When these polyps grow, they can cause bleeding in the rectum or in the stool. However, it's crucial to remember that rectal bleeding can also be a sign of other conditions, like hemorrhoids or anal fissures, which are less serious but still require medical attention. Now, if you're thinking, I've had rectal bleeding before but it stopped on its own, I would still urge you to consult a healthcare provider. Often symptoms like rectal bleeding may come and go, leading individuals to downplay its seriousness. But remember, intermittent symptoms can still be symptoms. Let's say you've never experienced rectal bleeding before and you're wondering, how would I know if it's serious? Here's a simple rule of thumb. If you notice blood in your stool or if you're experiencing rectal bleeding for the first time, it's time to talk to a healthcare professional. They can help determine the cause and the best course of action. And here's one more important thing. Don't let fear or embarrassment keep you from seeking medical help. Your health is paramount, and healthcare professionals are trained to handle these situations with utmost confidentiality and respect. So if you notice rectal bleeding or blood in your stool, don't brush it off. It could be a sign of something serious like colon cancer. Don't ignore this symptom. It's always better to get it checked out. Moving on to our third warning sign, persistent abdominal discomfort. Abdominal discomfort can be a rather vague symptom, but it's important not to dismiss it, especially if it's persistent and doesn't seem to be connected to any particular food or activity. This discomfort can take many forms. It might present as a dull ache or a sharp pain. It could be intermittent, coming and going seemingly without reason, or it might be constant. The discomfort may be localized in one area, or it might spread across your belly. It's also possible to experience a feeling of fullness or bloating that just doesn't seem to go away. One might wonder, why does colon cancer cause abdominal discomfort? Well, as the tumor in the colon grows, it can cause a blockage, leading to a buildup of gas and waste material. This can result in a cramping sensation or general discomfort. As the disease progresses, the pain may become more severe and constant. Now, it's important to note that abdominal discomfort can be caused by many things, not just colon cancer. It can be a symptom of less serious conditions such as gastritis, ulcers, or even just a stomach bug. However, if the discomfort is persistent, meaning it doesn't go away after a few days, or if it's severe, it's definitely something that should be checked out by a healthcare provider. Moreover, if this discomfort is accompanied by any of the other warning signs we've discussed, such as changes in bowel habits or rectal bleeding, it's even more crucial to seek medical advice as soon as possible. Don't fall into the trap of thinking it's probably nothing or that it'll go away on its own. Early detection is key when it comes to colon cancer, and the sooner it's diagnosed, the better the chances are for successful treatment. In conclusion, persistent abdominal discomfort is something to take seriously. It's not something to be dismissed or ignored. It's a signal from your body that something isn't quite right, and it's worth taking the time to investigate what's causing it. If you're experiencing persistent abdominal discomfort, it's time to consult with a healthcare provider. The last 3 warning signs we're going to discuss are fatigue, unexplained weight loss, and iron deficiency anemia. Let's start with fatigue. We all know what it's like to be tired after a long day at work or a sleepless night, but the fatigue we're talking about here is different. It's a constant, lingering tiredness that doesn't improve with rest. This kind of fatigue is often due to the body's energy being diverted to fight off disease, or it could be a result of the body not absorbing nutrients properly due to a tumor in the colon. Fatigue is a common symptom in many diseases, not just colon cancer, but if you're feeling unusually tired all the time, it's important to talk to your doctor. Next up is unexplained weight loss. Now, if you've been trying to lose weight and succeeding, congratulations. But if you're shedding pounds without trying, it could be a cause for concern. Unintentional weight loss can be a sign of many serious health conditions, including colon cancer. Tumors can cause a decrease in appetite or make the body work harder, leading to weight loss. If you've lost more than 10 pounds without trying in the last 6 months, it's time to see your doctor. Lastly, we have iron deficiency anemia. This is a condition where your body lacks enough red blood cells to carry oxygen to your tissues. In the case of colon cancer, this can occur if a tumor in the colon is slowly bleeding, leading to a gradual loss of iron in the body. Symptoms of iron deficiency anemia can include fatigue, weakness, pale skin, and shortness of breath. If you're experiencing these symptoms, it's crucial to get them checked out by a medical professional. Now, it's important to remember that these symptoms can be caused by conditions other than colon cancer. Fatigue can be a sign of stress or a lack of sleep. Unexplained weight loss could be due to changes in diet or exercise routines. And iron deficiency anemia can be caused by a range of issues, from dietary deficiencies to menstrual bleeding. But when these symptoms persist, or when they're combined with the other signs we've discussed, it's essential to seek medical advice. Colon cancer is a serious disease, but when caught early, the chances of successful treatment are significantly higher. So take care of your health, listen to your body, and don't hesitate to seek help if something doesn't feel right. These symptoms might seem general, but when combined with other signs, they could point to colon cancer. We've discussed the top 6 warning signs of colon cancer today. This is key information that could potentially save lives, as early detection is often critical in treating this disease. Let's quickly recap what we've learned. Firstly, we delved into changes in bowel habits. This could mean anything from constipation to diarrhea, or even a change in the consistency of your stool. If these changes persist for longer than 4 weeks, it's time to consult a healthcare professional. It's essential not to dismiss these changes as just a stomach bug or a result of something you ate. Next, we highlighted the warning sign of rectal bleeding or blood in your stool. This symptom is a significant red flag and should never be ignored. It's crucial to remember that bleeding doesn't always present as bright red blood. Sometimes it can cause your stool to appear black and tarry. If you notice any blood after using the bathroom, it's time to call your doctor. Our third warning sign was abdominal discomfort. This can include cramps, gas, or pain that persists. While everyone experiences abdominal discomfort from time to time, it's the persistence of this discomfort that can be a warning sign of colon cancer. If you're frequently troubled by abdominal pain that doesn't seem to go away, it's worth discussing this with your doctor. In the final segment, we discussed 3 more warning signs: fatigue, unexplained weight loss, and iron deficiency anemia. Persistent fatigue, even with plenty of rest, can be a symptom of colon cancer. Similarly, losing weight without trying might seem like a dream to some, but it's often a sign that something is wrong. Iron deficiency anemia, which can cause symptoms like pale skin, weakness, and shortness of breath, can be another warning sign. This happens when tumors in the colon bleed slowly over time, leading to a loss of iron and red blood cells in your body. Having discussed these warning signs, it's important to note that having one or even several of these symptoms does not necessarily mean you have colon cancer. These signs could be associated with a variety of other health conditions. However, they all warrant medical attention. If you're experiencing any of these symptoms, it's crucial to consult with a healthcare professional. Prevention is always better than cure, and early detection increases the chances of successful treatment significantly. Regular screenings, especially for those over the age of 50 or with a family history of the disease, are a key preventative measure. It's also worth noting that lifestyle plays a substantial role in colon cancer risk. A diet high in processed foods and low in fiber can increase your risk, as can a sedentary lifestyle. Therefore, maintaining a balanced diet rich in fruits, vegetables, and whole grains, along with regular exercise, is crucial in reducing your risk. In conclusion, the importance of being aware of these warning signs cannot be overstated. Your body has a way of telling you when something's not right, and it's crucial to listen to it. Don't ignore these signs. Take them seriously and seek medical advice if needed. Remember, knowledge is power. Stay informed and take care of your health. Knowing the warning signs of colon cancer and acting upon them promptly can make all the difference. Let's continue to prioritize our health and well-being. Let's stay vigilant, proactive, and informed. Before we wrap up, we have a small but important request. If you found this video valuable and want to continue learning about such crucial health topics, we encourage you to subscribe to our channel. We strive to bring you the most accurate, timely, and important health information to help you take the best care of your body. By subscribing, you'll ensure you never miss out on these vital insights. Also, don't forget to hit the notification bell. This will keep you updated with all our latest content, so you're always in the know about the latest health news and advice. Thank you for watching. Remember, your health is your wealth. Knowledge is the first step towards maintaining and improving it. Stay informed, stay healthy. Your body will thank you for it.